Breast cancer. Understanding, treatment, and cure. Introduction. Breast cancer is one of the most common types of cancer affecting women worldwide, though it can also occur in men. It develops when cells in the breast grow uncontrollably, forming a malignant tumor. Understanding the biology, risk factors, symptoms, diagnosis, treatment options, and ongoing research is crucial for addressing this pervasive disease. Understanding breast cancer biology of breast cancer. Breast cancer typically begins in the cells of the lobules, milk-producing glands, or the ducts, passages that drain milk to the nipple. It can be invasive, spreading into surrounding breast tissue, or non-invasive, remaining confined to ducts or lobules. Types of breast cancer: ductal carcinoma, in situ, DCIS, non-invasive cancer confined to the ducts. Invasive ductal carcinoma, IDC, the most common type, starting in the ducts and spreading. Lobular carcinoma, in situ, LCIS, non-invasive cancer in the lobules, a marker for increased breast cancer risk. Invasive lobular carcinoma, ILC, starts in the lobules and spreads. Triple-negative breast cancer, TNBC, lacks estrogen, progesterone receptors, and HER2, often more aggressive. HER2-positive breast cancer, high levels of HER2 protein, which promotes cancer cell growth. Risk factors: genetic factors. BRCA1 and BRCA2 gene mutations significantly increase risk. Family history: a family history of breast cancer or ovarian cancer. Age: risk increases with age. Hormonal factors: prolonged exposure to estrogen, such as early menstruation or late menopause. Lifestyle factors: alcohol consumption, obesity, and lack of physical activity. Radiation exposure: previous radiation therapy to the chest. Symptoms of breast cancer: early detection is critical for effective treatment. Common symptoms include a lump or thickening in the breast or underarm, changes in breast shape or size, dimpling or puckering of the skin, nipple discharge or inversion, redness or scaling of the nipple or breast skin. Diagnosis of breast cancer: clinical breast exam. A healthcare provider examines the breasts and underarms for lumps or other changes. Imaging tests: mammography, X-ray of the breast to detect abnormalities. Ultrasound uses sound waves to create images of breast tissue. Magnetic resonance imaging, MRI, detailed images using magnetic fields, often for high-risk patients. Biopsy, fine needle aspiration, FNA, extracts cells using a thin needle. Core needle biopsy, removes a core of tissue using a larger needle. Surgical biopsy, removes a part, incisional, or all excisional, of a lump for examination. Pathology report, analyzes biopsy samples to determine cancer type, grade, hormone receptor status, and HER2 status. Staging of breast cancer: staging helps determine the extent of cancer and guides treatment decisions. Stages range from 0, non-invasive, to IV, metastatic, based on tumor size, lymph node involvement, and spread to other body parts. Treatment options for breast cancer surgery: lumpectomy, removes the tumor and a small margin of surrounding tissue. Mastectomy, removes one or both breasts, partially, segmental, or completely, total. Sentinel lymph node biopsy, removes sentinel lymph nodes to check for cancer spread. Axillary lymph node dissection, removes multiple lymph nodes if cancer is detected. Radiation therapy, uses high-energy rays to destroy cancer cells, often after surgery to eliminate remaining cancer cells. Chemotherapy, uses drugs to kill cancer cells, shrink tumors before surgery, neoadjuvant, or destroy remaining cells after surgery, adjuvant. Common drugs include anthracyclines, taxanes, and cyclophosphamide. Hormone therapy. For hormone receptor-positive cancers, therapies include tamoxifen, blocks estrogen receptors; aromatase inhibitors, AIs, lower estrogen levels in postmenopausal women; ovarian suppression, shuts down ovaries in premenopausal women. Targeted therapy targets specific molecules involved in cancer growth, such as HER2-positive cancers treated with trastuzumab, Herceptin, and pertuzumab, Perjeta. Immunotherapy boosts the body's immune system to fight cancer, showing promise for certain types like TNBC. Research and emerging treatments. Genomic testing analyzes genes in cancer cells to tailor treatments, predicting which therapies will be most effective. PARP inhibitors. For BRCA-mutated cancers, these drugs block DNA repair in cancer cells. CDK4/6 inhibitors target proteins that control cell division, effective in hormone receptor-positive, HER2-negative cancers. Immunotherapy. Pembrolizumab, Keytruda, has shown effectiveness in combination with chemotherapy for TNBC. New surgical techniques. Advances in reconstructive surgery and oncoplastic surgery improve outcomes and quality of life. Prevention and early detection lifestyle modifications. Healthy diet. Emphasize fruits, vegetables, whole grains, and lean proteins. Regular exercise. At least 150 minutes of moderate activity per week. Alcohol limitation. Reduce alcohol intake to lower risk. Regular screenings, mammograms, recommended annually or biennially for women over 40 or earlier for high-risk groups. Genetic testing for those with a strong family history or known genetic mutations. Preventive medications, tamoxifen and raloxifene, reduce risk in high-risk women. Aromatase inhibitors for postmenopausal women at high risk. Prophylactic surgery, mastectomy and oophorectomy for those with high genetic risk, for example, BRCA mutations. Conclusion: breast cancer remains a significant health challenge, but advances in understanding, diagnosing, and treating the disease offer hope. Early detection through regular screenings and awareness of risk factors is crucial. Treatment options have become increasingly personalized, with a range of surgical, medical, and emerging therapies available. Ongoing research continues to refine these approaches, aiming for more effective, less invasive treatments and ultimately a cure. With a combination of prevention, early detection, and advanced treatment, the outlook for breast cancer patients continues to improve.